We're ready to go. We're going.
Hey, friends.
Hi, welcome back.
Shock Talking is here. If you've never been here before, then you are in for a treat. Why? Because we're going to talk about the vagina.
Rejuvenation.
Making it all pretty like Jesus made it a long time ago. This is Rena Hyatt, and she's with Enlightened Laser. You are the expert, and you and I have talked about this for many things. And here's the deal. I want y'all to understand. This is not, this is a subject that is happening.
Well,
Do you ever jump on the tramp and pee on yourself?
No, but if I can't hold it like I used to, and if I laugh too hard.
Bingo!
Right?
Okay.
Take
right?
up, yes.
If the
Rena?
bladder is held just a little bit too long, all of a sudden it becomes an emergency situation.
Tell me
Yes.
how, and if I have caffeine, it's one of those too. I gotta go.
Yeah.
Is that what's going on? My vajiji needs to be rejuvie? Is that what needs to
Yeah.
happen?
Yeah, because
Bingo.
what's happening is you're leaking urine and your urethra doesn't have support anymore. So we want to put that collagen cushioning in the vaginal canal, which sits right underneath the urethra.
And how do you do that?
There you go.
It's like a...
Well, with our treatment. That's how you do
Don't
it.
do any hand motion. Camille had the clamp.
Sorry.
Got a thing going. No, listen to this.
Tell me how you do it.
Okay, so Genevieve is the treatment name, right? Genevieve is going to be different
Like,
than
such
any
a
other
pretty
treatment.
name.
It
I
is.
really
They've
like
named
this,
it.
Genevieve.
I feel like it's more personal, right?
Yeah.
Yes.
Yeah.
So
So-
it's very personal.
You could call it like Ted too.
Whatever. But the point is that it actually does work, and it works so much better than other treatments. It really does. So they've got CO2 laser. We're not CO2. Okay, we're not going to
Ow.
be cutting the tissue.
Ow. Ow.
Thank you.
I know.
Okay,
No one
I'm all
wants
right.
anything going near that area that's cutting,
Yeah.
right?
Yeah, no.
But so many women do, and it's because they didn't know that this existed, right? So,
And that's the whole thing is, I think a lot of women, and we're not just talking about the way it looks, we're also talking about
The functionality, right?
Well, not only that, but you talk about maybe you're not having orgasms or they're not as good, or, there's a lot of issues that a lot of times people just talk it up. This is just aging. It's just what happens. I've had babies. This is what happens.
but I don't
Instead of
wanna go
going,
there.
wait a second, there's actually...
I'm not ready to go there.
well,
all
and
talking
so many
about?
physicians still say that too. I mean, there's a combination of things that you can do. Vaginal health treatments like this one, and hormones as well, because hormones are going to make the aging process a lot easier on women. So
agree with
bioidentical
that.
replacement combined with a treatment like this, depending on your age demographic, is going to be kind of the optimal way to go,
Right.
right? So
And this doesn't have to do with just aging. I mean, it could just be genetically how you're made up, right?
yeah, it definitely could.
Yeah.
I mean, you could have thinner vaginal tissue, but this treatment is made so that anybody can have it. Whether you're in your 20s, 30s, 40s, 50s. I mean, we've had a 74-year-old patient too.
You go, girl.
Yeah,
She's
I
like,
know.
get it
You.
better.
We'll call her Lucille.
Yeah.
I'm gonna name everybody. So make sure I understand this correctly. So there is it's on incision.
With your...
Oh, let's see here.
We just got to see it.
I
talk with my
I
hands.
know there's a gadget near you.
I should have brought the treatment tip, actually,
I
because the
would've
treatment
loved-
tip literally is this big. It's the size of your thumb.
So
it's
shut
that
the
big.
hell up.
I know.
That's it.
Tampons and dicks are bigger than that.
Yeah. It's so non-invasive. It really is. So
And at the end of that procedure, I'm gonna be
It's one time.
performing. That's amazing.
You could-
What does it cost?
Well, so the prices
Insurance?
no, it doesn't.
No, of course
I
not.
know, guys. I'm
Come
sorry.
on, insurance
I
company.
know. I mean, really, when women have children and we're maturing in age, vaginal health tissue should be, or vaginal tissue should be
Yeah.
an
primary
issue, like a
concern.
primary concern.
I would
It
think
should
most
be covered.
men-
Like that's just my opinion, but
Look, and if men figure this, men that run insurance companies, you should figure this out. It's
should.
vital concern for you too.
You would benefit.
there
I
is
mean,
a huge market for this, by
Yeah,
the way.
yeah.
there's
So-
penile implants. There's breast enhancement.
we never
Why
talk
can't
about
we
the
fix
Virginia.
that? No. You know what? Here's the deal. Like
Genevieve.
your eyes vision goes sucky. Things happen, friends.
Vaginal
Well, I'll
tissue
tell you,
ages
Write
the
your
exact same.
legislator.
It's true, but as a counselor, you know what? I'll tell you the number one issue with couples is sex. Okay, and a lot of times as we get older, menopause hits, we're not as moist. It's painful intercourse. That is a definite problem inside of marriages. I could sell this for my clients.
Yeah,
Yeah,
I mean, that's what
really.
I see in my office every single day.
Yeah.
People are coming in for peeing during their workouts, or they're coming in for sexual dysfunction. Like,
Yeah.
I don't, maybe orgasm as good as I used to. The strength has
Takes me
just declined.
forever, yeah.
But most women are going to say, I don't feel like I'm as lubricated as I used to be, depending on the age demographic again. But
Yeah.
once you get this side of 40, that does tend to be an issue that women have. And Genevieve treats all of these issues at the same time. The
For
same
one
time. One treatment.
treatment.
One
And so
treatment.
exactly how does the treatment work? So this implant, this thing
This treatment tip. This treatment tip, yeah.
Notice I'm keeping my arms
enters
folded.
the vajayjay.
It does. So the treatment tip is going to be inserted. We have an OBGYN that does it. So
And it's a she.
It's a she.
Thank you.
She, OBGYN, Dr. Molly Mears. So we insert
Cute
the
name.
treatment tip. I know.
Yeah,
she's a sweet doctor. She really
Yeah.
is just a very zen energy.
Nice.
I love her. So she's going to insert the treatment tip. They're going to use a personal lubricant. So no pain, no fuss,
Yes.
no nothing.
What do you mean personal?
So like a KY jelly.
Oh.
We call it a personal lubricant.
I'm like, wait, do they have one with my name on it?
Right?
Don't try to have one of those.
lubricant.
I got my own. Camille has her own.
Right? No,
It's
really,
amazing.
we pencil in your name and it's yours.
Take it
It's
home
like
with
when you get, it's like when you go to American Eagle and they write your name on the outside of the
And you
dressing
feel like
door.
that dressing room is yours, right? Yeah.
you. Oh, man.
Okay, so
So the treatment tip is inserted, and once it is, at that point, Dr. Mears has the machine telling her how to do the procedure. And as that treatment tip is rotated, what happens is the radio frequency energy is pulsed into the tissue, so the entire circumference of the vaginal canal is treated. So pulsing that treatment tip for 30 minutes all the way around the vaginal canal, right?
Wow.
So you get pelvic floor, the sides, the top. And then as that radio frequency energy is pulsed into the tissue, cryogen is simultaneously cooling that tissue so the patient feels no pain at all. None.
Wow.
You're going to feel no pain.
That's nice.
I've had the treatment myself, no pain.
No
I mean,
pain.
it just felt like a finger. It just,
Wow.
it just felt like a warming sensation. That's it.
a warm finger.
A warm finger.
It could be
That's
good.
it. Well, I mean, and it's amazing too because as that collagen builds, we're going to be putting all of that collagen cushioning into the vaginal canal, and so many benefits, right? Not to mention, I mean, the sexual function side of things.
Sure.
We're talking about not peeing during your workout. We're talking about more lubrication. We're talking about, I mean, goodness sakes.
There's not one bad thing about this. And so here's what we as Shock Talking want to share with y'all is I know you're like, it doesn't look the same, it doesn't feel the same, blah blah blah, all your symptoms, it can be treated.
Yeah.
And who would have thought? I mean, really, this is the simplest thing I've ever heard of. We researched a handful of things, and this is like
I know.
one and done. Really?
Well, it's the technology is beautiful.
Yeah.
I mean, when I've read through the studies and stuff, I mean, it took them some time to
Sure.
get the technology of heat
I'm
energy.
gonna pull your hair away just so we
Yeah,
hear.
heat energy combined with cryogen. That is beautiful technology to make sure that the patient doesn't feel any pain, and 10 times deeper into the tissue than cutting. I mean, CO2, they cut the tissue,
Can
right?
you, just the word cut in
know.
that area makes me go,
Well, we're such a it's such a vascularized area. It won't. I mean, that would just be painful. It wouldn't heal quickly either.
No, I mean, there's downtime. You're going to have 2 to 3 days of downtime with CO2 laser, and they ablate the tissue about, I mean, you can't see, but it's like squeezing your fingers together, and that's how much they ablate every single time, 3 to 4 times over the course of 3 to 4 months.
That just
Oh,
drives
you
you
gotta
out,
keep
doesn't
going
it?
back.
You have to keep going back. And by the end,
you're
theoretically,
divorced.
I
Because
mean,
he's like, I don't want to wait any longer.
it just,
Yeah.
we are able to go cellular. So we don't even have to worry about cutting your tissue, and we're able to go 10 times deeper into the tissue.
Gosh,
than
and
cutting
here's
it.
the deal. If you have a choice,
Yes.
why would you choose to have something ablated? I hate that word. But
Well,
just
they,
Ablation,
the
yeah.
ablation happens in the uterus to slow down the flow. If you have heavy
Well, yeah.
cycles,
Yeah.
is that a similar thing we're talking about?
I mean, similar, yeah. So that's going to be more obviously internal, and this one's going to be external. But yeah, I mean, similar type of thing. You think of ablation, it's cutting and cauterizing almost at the same time. So it's creating like scar tissue, right?
Right.
Hey, let's talk about, so we've talked about the internal part of the vagina. What about the exterior? How do you make that pretty again?
The labia,
'Cause
the
Camille-
lips.
There are treatments out there.
Oh yeah, like you know anything.
We've already discussed the color of her asshole, so now we're going to move that
I've been
a little
working on-
north.
I got my bleaching cream. It was a gift from Gretchen for my birthday, and I'm working on it.
I am a good friend.
Oh my gosh,
I have no one
love
to.
it.
I need someone to kind of check the color. I'm taking pictures. I'm gonna get some
Oh,
pictures.
shut up. Y'all, we are not taking pictures. Okay? For all you porn
Don't
freaks out there,
get
we
me
are not
started.
showing.
No.
You know what though, but there's a part that, I mean, in a serious note, You know, and you were the one that were saying this, Rena, that the porn industry has kind of created this look that is not really, man, it's just not real. Those porn stars are, first of all, like really young. They haven't had babies. I mean, they're
Or it's airbrushed. I mean, the pictures are airbrushed.
Well, I'm just saying, like,
Well,
even
the
a
video.
video. I don't know.
Even just think about this. Who says that a vagina that has close labia, I mean, because we all kind of have it in our head.
Yeah.
They have close labia, the clitoris is pretty much covered, and no hair. Who says that that's the perfect vagina? I'm
Right.
sorry, but who says that?
Right,
Who made
right.
that up?
Stop your madness.
Right?
Everyone's going to be completely different.
That's
There
right.
are
That's
so
right.
many different vaginas. All you have to do is Google it. I mean,
I don't want to, but okay.
honestly, but being in my profession, I mean,
yeah.
that's something that I
Yeah.
hear about all the time. So
Yeah.
Yeah.
everybody's different.
So probably women come in because they think they're so abnormal.
I
When
mean-
what is normal, right?
Well, what is normal? I think most women come in with this feeling of like, I'm scared to talk about this. I'm scared
It's
to say,
embarrassing.
yeah, I'm scared to say that I don't orgasm the same way, or I'm scared to say that I
don't
pee my
get wet,
pants.
or- yeah.
Yeah, or I don't get wet. Yeah, when
yeah.
they don't have enough lubrication, to them, it feels like there's something wrong
There's
with me.
something wrong,
Yeah,
yeah.
and we always make sure that we lay it out on the table and say, no, this is completely normal. Depending on your age demographic, we're going to see a lot of different things, right?
Yeah, absolutely.
And what may be normal at one age doesn't mean that a year from now it's going to be the same.
Exactly, right? It could change in a year. And that's honestly, once you start to notice a change, I hope that women will understand that there are solutions out there and not wait. Like some of the patients that I have, they've been waiting a long time, and it's because there haven't been treatments out there to help them. You can imagine being
yeah.
74 years old. What was available to you? Well, now
Yeah.
there is something. So now, I mean, power to her. I mean, honestly, that's so great.
Absolutely.
Well, it's such a foreign language to people over 30. I mean, this is something I would have never imagined.
Mm-hmm.
But again, talking to the clients that I do, it is a very big deal in a marriage.
Very big.
Because, you know, he's starving and she's in pain or she's dealing with something that she has no control over.
Mm-hmm.
And so if this could actually treat them so they could actually enjoy sex again, wow, this could probably save a lot of marriages or prevent cheating.
Mm-hmm.
You know, I mean, people renegotiate sex when they get older because some women just say, I just can't do that anymore. It's painful. I don't like it. I don't want to.
Right.
I'm not working
I
the
see
same
that
way.
every day.
Yeah. Not that she doesn't want to, but she doesn't want to go through what she's going through.
Right.
So even, I mean, I hate to say this, but what about odors? I mean, some women have a problem with odors. Does this help with that?
So this treatment isn't going to help with odors, but if they have odors, I think I always mention to patients, it's always worth going to your primary care and getting it checked out, because it could be just as simple as taking an antibiotic.
Yeah.
It
Exactly.
could be something that simple. It doesn't have to be an STD to create an odor. It could be something as simple as bacterial vaginosis. I mean,
That's caused by sperm usually. Okay.
It can
so
be,
what-
yeah.
I mean, smell. No, really, smell is usually from the I think it's called mammon or ammon. It's a hormone from men, and so when women have sex with their men, they have an odor, and so that's just not going to go away unless they treat
Is
it.
that why? I know this isn't the primary reason, but since we're talking about girl stuff, is that why douching started?
I don't know. I mean, that's a really good question. I can imagine that's probably it. I
Probably.
mean, but it's not abnormal either. I mean, some women feel like they smell, but truly that could be just your pH level being off.
Yeah,
it could
yeah,
be
yeah.
a lot of different
That's right.
things,
Yeah.
right? So,
And it's so
But
funny
women are all
because
embarrassed about this stuff.
I
you
know, but men are like, "Oh, the sweet smell of sex," and women are like, "Oh, it stinks."
I think that's fair to
true.
say, right?
It's true.
I think that's fair to say.
You know what? And also, you men, and I'm not saying everybody does this, but if she has to use a lubrication, don't make her feel bad.
Right. Just make it part of the process.
Oh my gosh, you
Just
know
make it-
what? If
make-
you
she's
have
She's trying. She's trying. I mean, she's
Exactly.
desperately trying to facilitate
Yeah.
having intercourse, having these relationships.
Because I bet she's patient when you can't get it up. I bet she is.
And that's a classic
Or when
symptom
it's
over
sexual.
40. Yeah, and when a guy has no problem like that, you're right.
Yeah.
Absolutely.
Yeah.
Absolutely. Yeah.
So if your woman is genuinely trying, or say like, if we have males watching this show, if your wife or spouse or significant other is considering doing a treatment like this, just listen. Just listen. It doesn't mean you have to say, okay, yeah, I mean, go ahead and do that. But I feel like if a woman is wanting to do that for herself, just listen as much as you possibly can,
I
because
agree.
Because it's not your decision.
and it's kind of intimidating to talk about this kind of thing with men. It just is, because
Yeah.
they don't understand.
Well, and a lot of them just go, I don't even want to know. I
Right?
just can't
Just
even
go
know."
ahead and do it. That's fine.
So, Chrisley Knows Best actually had an episode where Julie went in with her girlfriend, because her girlfriend was kind of afraid and she just wanted to go in for a consult. And meanwhile, Julie's listening to, she's like, oh my gosh, this is kind of a good idea. So she goes home and she tells Todd, her husband, and he goes, no, I like it just the way it is.
Right.
And he had this big front, like, you're forbidden for doing that.
I ain't gonna change it. It's just gonna help her like it more.
It's
and that's
only
the-
going to help things.
Right.
Yeah.
We're never going to be damaging tissue, which is the amazing part.
This would be neat to have this right after. I mean, I'm not sure how soon after a baby, but really, maybe within the first year of a baby, this could be a natural procedure.
Yep. I mean, after you're
why-
done breastfeeding, that's
Yes.
when I think is a great time to do it.
Oh, I'm done.
And just keep up on that collagen.
Are you
'cause
done?
It's been done for a while.
Well, I mean, really, y'all, we talk about collagen all the time. Why would you not think that the tissues inside your vajayjay are collagen based?
They go through so much.
Yeah, and if that goes away,
So true. Whatever you see in the mirror, literally, whatever you see when you're looking in the mirror, whether it's fine lines, wrinkles, or your chin just, starting
yeah.
to fall, can't get up.
oh, don't even finish
That,
the sentence.
that is what's happening to your vaginal tissue. It just is.
Yeah.
It doesn't look exactly the same, but if we're getting dry vaginal tissue
Yep,
too,
we
you
have-
can think of how painful it would probably be, that dehydrated tissue, if you're trying to facilitate
Yeah.
sex.
That's right.
So
How much of a woman being dry is not just physical, but it's mental? Is she worried? Does that play a part?
I think anxiety does play a big part of it. According to most of my patients that come in, but here's where it starts first, is the dry vaginal tissue, not having enough lubrication is already an issue.
Yeah.
So then they start going here and having to kind of check out during intercourse. While they're having sex, it's just kind of like, so you can imagine
Yeah.
their body isn't really even trying to or allowed to
Yeah.
produce their own natural lubrication.
Totally,
What do you say?
totally.
Yeah. So then
Well,
it
and then
becomes this
they're
vicious
getting-
cycle.
And then if they're dry and it hurts and there's friction and you're tearing a little bit, that's not going to make it any easier either.
I have a lot of women say, I just kind of hold on and hope for the best, and I'm trying to just maintain my relationship. It's sad. poor
I hear
thing.
the same thing.
Yeah.
And especially if they don't talk about it to their partner, then the guy has no idea, right? He's just like, and
A lot of them do, and I think a lot of men. In fact, I would say most men. I mean, honestly, I would say most men are very caring to their partner when it comes to the fact that she is in pain,
Yeah.
doesn't have enough lubrication.
Yeah.
I wouldn't say that I've heard a lot of heartless men. Sure, there's stories out there from my
Sure,
patients
but-
who
They're
have
bullies,
experienced
not
something.
men, though. Yeah.
Right, exactly.
yeah.
But I think most men are very willing to try to help their partner accomplish the goal of being intimate together. I mean, and that says something too about relationships, I think. I mean,
how
like
how
that.
much of this, when you're counseling, if you said, you know what, I know of a treatment that could
no.
be a
I have
98%.
I think I'm
improvement.
thinking of 6 couples right now that could use this. I mean, I'll tell you, a lot of women fake orgasms, and you want to know why? It isn't because they don't really want sex. It hurts. It's like, oh yeah, I'm good, I'm done, I'm good. So they will finish because they want to get this over with as quick as possible because they're in pain. So a lot of women will fake it. I had a woman confess to me her husband was dying, and she was really difficult with him and really critical. And I said, "What are you hiding from this guy? Why are you like this?" She admitted to me that she has never climaxed. She was in her 70s, had been married 50 plus years. She's never had orgasm. It hurt her all the time because she was dry, and she was so embarrassed she could never admit it, and she would never want to use lubrication. And he was pretty fast, thank God, she said. And I said, "You're going to confess that before he dies." I made her do it. She did, and they both cried. It was really, really emotional. But he was dying of cancer, and they got closer in the last year of their marriage than they'd ever been in their life.
Because they were real and
They got
honest.
real. Yeah, the lie was over. Yeah.
And here's the thing I think about, Rena, on a really serious note is how many couples, especially the women dealing with this, are thinking I just don't have it for my husband because I can't get wet, or whoever that person is, or what's
You make it
wrong with
mean
me?
something,
What's
yeah.
wrong with me?
I mean, honestly, if you had to put a percentage on it, it'd be like 60% of women feel that way, that it's them. That they feel like it's them. I really do. And most women, I have to say, I make it a very open space when they come into my office to talk about
We
this.
can tell. We love
Right?
talking to you.
I
You're
mean,
great.
thank you.
Yeah,
That's nice of you.
truly.
But the thing is I want women to just unload. Whatever you've got, just let it out.
Leave that burden with you.
Yes, because we need to know everything to be able to treat you, and not just physically. I'm sorry, but this is kind of like, you know,
This is
a
therapy.
mini therapy session,
Yeah.
because if you're going to
So
go in and
great.
have this treatment, I think it's worth talking about everything.
Agreed.
And so that's why I schedule like 89 minutes on my schedule. So we're in there for a good chunk of time if they need it.
Aw.
So
I love that.
I think
Because
it's
that's probably the
important.
first time they've ever opened up. And it's not
In this
just
area,
about
yeah.
the symptoms, but it's about the emotional that goes behind it and with it. And, you
Yeah.
know,
Well, it is kind of like sex therapy, girl.
Yeah.
Now, I do a lot of that too, but it's good to know that, and then they're going to get treated for whatever's going on with them.
Yeah. So, I mean,
That's brilliant.
I am not a sex therapist. All I am there to do is
Correct.
consult, to listen, to make sure that my patients are getting treated the exact way that Dr. Mears would want them treated in consult. So then I can hand them off once they're ready to do it. And we have a beautiful result. They feel like they were actually listened to. And
Yeah.
then physically, they're getting the treatment. Like, there you go, you know?
because is the treatment the
Look at
same?
the
Burden,
world.
50 years. That's right.
Is the treatment the same? Is it the same process for everyone?
It is pretty much. There are two different treatments that we can do, and it depends on the patient, depends on the severity. So that's why we always say prices vary, and we don't like to give a baseline.
Sure.
But yeah, I mean, there's two different treatment tips at two different lengths. One's going to be about the size of your thumb, one's going to be just about double the length, and we can do both even. So you could have just this one for 30 minutes. You could have the secondary protocol, which is this size, and then one that's double the size. I know it's kind of like all over the place, but we try to customize
Right.
it for the patient. So if someone
Nice.
has a lot of issues,
Yep.
then we're going to make sure and do
She
two
just looked
the
at
two
you
treatment tips.
when she
No,
did
no,
that.
that's
Did y'all
not-
notice
no, no,
that?
That's not what I meant.
A lot of issues.
No. How you were
Sugar. You could not offend me. Sugar.
No, that's not what I meant. I meant how she was talking about how
Yeah.
lots of women have lots of different
Uh-huh.
issues.
Yeah.
That's all I meant. So we'll do the treatment different on them. Oh my gosh, I
You're
love
so
it.
cute.
But in mouth.
No, there's just not a chance to bug on
You
Camille.
not watch our podcast? She busts my balls all the time,
Oh
right?
my
Oh no,
gosh,
it's
I love
hilarious.
it.
Yeah, it's fun. I enjoy it. That's when I laugh my most, when I made fun of. Seriously.
It's actually really good to talk to somebody who has the perspective from the
Yeah.
sex therapy
Yeah.
side of things.
Yeah.
My mom was
seriously.
a therapist and she did sex therapy, but it's different when they're your mom, right?
True.
Oh, yeah.
Very
it's good to
true.
hear
Certain
this
words you
side
don't
of
want
things,
your
too.
mom saying.
Yeah, right?
I'm just so happy that people can.
Get help.
You know, here's what keeps coming to my mind, Rena, is that, you know, when a woman decides she wants breast augmentation or a boob job, she saves up,
Yes.
right?
Pays
That's
cash,
important
yeah.
to her. You know, her husband's supportive or whoever it is, or maybe she just does it for her. Why wouldn't you want to take care of this area too?
Agree.
Oh, I know. That's
Agree.
why we have so many women doing the
Especially
treatment.
even if it has nothing to do with having sex, and it's just a matter that you want to go run.
Yeah.
You
Without
want,
peeing yourself.
Yeah, you want to do all
Yeah.
these things because paint this picture. I mean, you're in a Zumba class, and you can't even finish the class because you've got to leave.
Mm-hmm.
How humiliating!
I know. I have some women who literally have had to go and change their pants. Like, it was that bad.
You
It
laugh.
just-
I mean, there could be all
Yeah.
kinds of things.
Well, you know, I think it's worth mentioning. I think we forgot to mention this towards the beginning. Insurance does not cover this treatment. However, our office can take health savings accounts, flexible spending accounts,
good.
and we take all major credit cards. And the reason why we can take those is because we're a private practice clinic and Dr. Mears is an OBGYN.
Nice.
So it's going to be different. you
Yeah,
know?
yeah.
So
So
if they
there's-
have that money
there's
saved up.
option. Yeah, and like you said, and even if you don't have the lump of whatever that is, you
Yeah.
can make a payment on it.
Absolutely. We
You
take
know, I
care
think
of
when it comes to anything aesthetic or medical, if we want it bad enough, we figure a way out.
We do.
Exactly.
You know,
Well, this is a necessity for a lot of couples. And I think when men really understand the value, I mean, this has been a very informative little segment. Thank you, really, because I think the men hearing this would want their women to do it. Frankly, and probably pay for it. Did we cover the exterior? Or is that, did we talk about
We
the...
didn't. So Genevieve doesn't treat the exterior, so
Okay.
the labia isn't going to be treated with it. However, just so women know, there are treatments out there that can resurface
Yeah.
the outer labia and the vaginal tissue. But Genevieve does not do that, not yet. we'll see.
Nice.
I know it'd be sure nice, but the CO2 treatments for the outer labia are going to be like we've talked about. They're ablative, so there's going to be some downtime. I mean, but it does resurface just the same way as you would do a CO2 on the face. It's going to be resurfacing the.
So if you used any machine professionally, had it done, that tightens and lifts and does all that things to the face, can you use that same machine down there?
That's a really good question. I feel like Dr. Mears could answer that one a little bit better
I mean,
than I
you'd have
could.
to, like, the frequency would have to be sensitive,
Or
right?
lightest.
I mean, Camille,
Possible.
I know the face, and the nerve endings. I feel like is different than the vaginal nerve endings that are right there. I mean, that's just I don't know. That's a really good question. I wish I had that answer for you.
We will find out.
We'll find it out.
Let you
She'll
know.
do some research.
Camille, do some research.
Well, this has been great.
I know. You know what? And here's the answer I think that most doctors will give to a woman is just do Kegels. You'll be fine.
I hear
What
that
the-
every day. I hear that every day, and those poor women are doing their Kegels just like
Seriously, they're at the
they
stoplight going,
are-
I can do this.
Well, and they're great at doing Kegels, but the problem is that strengthening the muscle of the pelvic floor does not fix
The
the
tissue.
cushioning of the vaginal tissue.
That's right,
It
that's
just
right.
doesn't.
Yeah, I mean, collagen is gone.
It's different.
It's like
Literally, you're-
deflating a balloon.
Yeah.
It's just
Yeah.
That's right.
there.
That's right.
When you create more collagen in the vaginal tissue, you're creating more, just so you know, you're creating more friction between you and your partner. So that's how come orgasm strength gets so much better, is
Nice.
because you've got a tighter
you
fit.
feel something,
Yeah,
right?
you do. You
Well, maybe
feel it.
we ought to schedule an appointment. Can she be
Yes.
in one room and I'm in the other, and we can, we're going in, and then we'll come out and let you
She's
know
like,
how it goes.
Gretchen's had 5 babies. We're gonna need 2 days.
Oh, she'll need the extra duty. I just,
She's like, I need that double probe.
you do the double probe.
Hey, I wanna
I
ask
think that'd be
you-
good for anybody. That one really is.
I would
Yeah.
do it.
I think so.
I want to ask a question about Camille. And you're in this industry. I get that you're not a doctor. Have you ever heard of an extra long vagina cavity?
The vaginal canal being long? Yeah, I think probably most OBGYNs have too. So, I mean, I've heard that from people. Yeah.
What's the average?
I couldn't put an average on it just because I don't hear it as often that they feel like they have an extended vaginal canal. Is that kind of what you thought?
We all,
No, it's not
I
matter
was-
thinking.
we aren't thinking anymore. We know.
Go ahead.
Okay.
No, I was in the stirrups, and just my annual, and I'm in my 40s, and I'm thinking, yeah, no big deal. He's a nurse. Would you bring me the extra long speculum?
Oh, goodness.
And I'm like, pop it up. What? What's that for?
Camilla, that's a super size.
I'm like, what do you need that for? And he said, well, all medical term. Well, you have an extra long vagina. I said, to tell. What do
everybody's
you mean?
different.
I had no clue. I'm short. I'm like 5'5" on a good day, and I wear heels everywhere. But I mean, I'm sure she has an extra. They call me LV. I'm sure she has an LV.
Why are you calling me out? What? You're short and you got a long one. Does that mean I have an extra long one?
You probably do. I think you're LV too.
Okay, but here's why Camille and I talk about this. And if there's guys listening, you need to understand the
God.
anatomy of a woman. So guys think that an extra long dick is just what women want.
Every one of them.
Oh my
No.
gosh.
No.
If you don't have the space
Yeah.
in your body to fit that,
accommodate
it's
it.
gonna be
Right.
Painful.
That's right.
I mean, you're going to hit rock bottom. You're not even going to get in there all the way. So
Well, bumping that cervix is painful.
Yeah.
But honestly, my doctor told me that the average length is about 5 to 6 inches for a vagina.
Camille's
Oh,
17.
interesting. He actually measured. It was that long.
Actually, refused to
He
measure.
goes to Home Depot and gets something.
Oh, gosh.
They had a round ruler. No, I'm like,
He
"Don't
just
you
wanted to see.
No, but he did say, you
Okay,
just
so
have the long one.
5 to 6
Fun
inches
enough.
is all that a woman can take on an
The
average.
average female is 5 to 6
Okay,
inches.
so when
before they
you
get that
guys
cervix,
talk
yeah.
about I got a 10-inch dick, that does us
It's actually,
no
yeah, it
good.
really doesn't because,
No, it
I mean,
hurts.
you want something that's got some girth on it, at least if we're talking like anatomy wise, in order to hit the G spot. That's where I'm going with this.
Yeah, that's right.
It honestly isn't that far into a woman's
Right.
vagina.
A inch
so
and a half
you
to
don't
2
need
inches in.
that. Yeah, you don't need an extra long one.
No.
But you do need that collagen cushioning. Otherwise, there's going to be too much space between the penis and the vaginal walls. So
Yeah,
then you're
so
not
it's
going
like-
to feel it. And a
it's like
woman's
air.
not going to be able to orgasm.
She's like, are you in?
That's right.
right?
Well, and some
Right.
women, they feel like, oh gosh, I just don't feel like, I mean, I like being close and I want to be with my partner, but I'm not climaxing. And
Yeah.
it's just not the same anymore because I'm more loose.
Yep.
Right?
Yeah.
So
And this is a way.
this is the way.
This is the way to get some help. And all you men out there, just know that there's nothing wrong with her.
No,
This can be
no.
treated. This can be taken care of
That's
one
right.
time. Is there a maintenance on this?
Yeah, you'll want to do a maintenance, and the reason why is because your body is
'Cause
going to
we
continue to break down
age.
collagen,
Yeah.
right? So we don't know. We can't say, "Oh, be back in a year." That's about your time frame, right? We just don't know. It could be a couple years. It could be 5. We just don't know. But when you start to notice that your results are waning, that's when you're going to be back.
Just come back.
Yeah, it's up to the individual patient.
Here's what I love that you said, Rena, is
Very good.
that you are the person leaving your office has a change.
Yeah.
Like you're guaranteed you're going to see, feel mentally
Renewed.
It's going to be
Yeah,
better.
renewed, yeah.
Mm-hmm.
I mean, and you just can't go wrong with that.
No, you
You know,
can't.
you go get your boobs done and you don't really know.
Right.
You don't really know how they're going to turn out. You know that this is going to be better because it's collagen.
Yes, this is absolutely going to be an improvement on any type of tissue, right?
amazing.
How much of an improvement is going to depend on the severity of the tissue laxity to
Yeah.
begin with. So you might feel like you want to do a couple maintenance treatments back to back within I don't know however long if you've got on the more severe side of things.
Right.
But if you're feeling like no,
It's all
I was
good,
just
sugar.
starting.
It's all good, sugar.
No, Jesus told you. And so
Oh my gosh,
You guys
you all
love to
know
ask
out
me.
there. Y'all know that I haven't had 5 kids.
I just keep changing my point of view.
You're good. You're totally good.
So on the more severe side of things, you may be back in our office
Thank you.
wanting a maintenance treatment, but
you.
that's not
But
something
Dr.
we could ever
Molly
say.
would know when she's in there. Like she would know, that Camille would maybe need more than 12 visits.
more than 12 visits over a lifetime?
No, but I'm just saying, because everybody's
great.
different.
Yeah.
And because she's an MD, like she would know to give you suggestions on, this is
Come
what
back in a
I'm-
year. Or,
She's not ever going to say to a patient, because we've discussed this at length, we feel like we want that to be up to the patient, because who's to say that their collagen rate of breakdown is going to be faster or slower than we would expect?
Good point.
Right?
Yeah.
So she's never going to say that. She does a thorough pelvic exam before each individual Genevieve treatment, so she does evaluate the tissue before she starts. That's just her profession. So
Oh, I was going to ask you this. What about like wearing tampons? Is that an issue?
an issue for
Well, I
Right
mean, like,
after?
is that right after? And is it an issue causing the?
dryness or anything?
No,
Probably
just
not.
the lack of elasticity.
No, I don't think so. I mean,
Damn it.
tampons are so
I think
super
5
small.
kids is exactly.
Shut up!
Yeah.
See, this is what Camille's doing. Camille's like,
Turnabout is fair play, all right?
Yes,
this
it
is,
is.
I know that domain over there had 5
Oh, I
children.
know. That domain?
That domain.
I got me a domain. Kelly, did you hear that? That's what we're calling it now.
We're calling Kelly.
Domain.
Yeah.
But not to worry about tampons. I don't think that's an issue because your body's rate of collagen breakdown doesn't have anything to do with a foreign
Object. Yeah.
object being inserted.
Yeah.
Otherwise, then we would be affected by penis insertion,
True.
right? But we're not.
True.
So it's just our
I'm
body's
just
own
saying,
rate.
like, does whether it's a penis or a tampon, does the stretching have anything to do with?
Well, I think if you have you
Well,
would
not
expect
Camille.
if you have a very, very large penis and
Oh.
a
No,
less,
she doesn't have a
maybe, like,
penis. Just
And
so
it
y'all
has
know.
to be
mean,
a short vagina.
we could talk about this and hypothesize maybe.
Right.
But as far as like just biologically,
We could do
no,
so.
that's not
Yeah.
going to really affect
Yeah.
it.
Yeah.
Okay.
Okay, good.
So all these men that are like, yeah, I did that to her. No, you didn't.
No.
No,
Oh,
you didn't.
that's right. All this stupid.
It's just aging,
All
children.
these wives' tales that men have been holding on for years has nothing to do with you.
And she does nothing with the anus, just all of a JJ.
all of the
Okay.
JJ.
Okay.
But wait, could you use that if people had like a anal problem?
I don't know. That's a good question. I don't know
Do
if it's ever
you?
been.
I knew
We should call this the JJ chat.
I
I've
think
been
so.
wanting to call something the
Oh, we
JJ
could
chat for
title
a
it
while.
that.
We will
the
title
JJ chat.
the JJ chat. We
I love
just
it.
that's our title, sugar. That works.
I know.
That's been
Maybe
good.
we should have gone live with this one because we just might have people chiming in.
We'd have a lot of hearts. And
No, but you know what? Find out because I bet there are some people that, because this is what I've been told by nurses, not that I care, but they always seem to especially the ones that work in ER, you know, they're like, oh my gosh, you wouldn't believe what we had to remove. You know, I'm
just wanna-
sorry,
yeah.
but if you're going to do something to yourself and you have to go to the ER, you just know those nurses are going to be talking about it. But this one particular nurse, she's a friend of Camille and I's, said, you know what, once that anal cavity is stretched, like it's not going back.
Correct. Yeah, that's right.
I've heard that too.
Yeah.
I haven't heard about a treatment for the anal cavity though.
I just wonder if that's
The anal
considered
tissue.
Yeah, anal tissue. Would that be the same as?
There's got to be
like
collagen in there, right?
Yeah, but it's not the same.
Yeah,
you know?
it's a sphincter.
Oh,
Like it's
stop
more
it.
muscular. I wonder if they could do like anal Kegels or something.
That's a thought. I wonder if that already exists and we just don't know.
I don't know. I need to ask some friends of
Let's
mine.
go do some research.
I'm gonna ask my him
How
on
would
Google.
you? I mean, like I'm trying right now. I can't do a Kegel down there. Can you move it?
Well, I mean, there's
Not
some
not
people
the
that.
vajayjay, but the other.
Haven't
know
you
what you're
heard of like
thinking.
some people like they do that and it's supposed to increase like I don't
Tightening
know.
or something?
Yeah,
Yeah, I
How?
heard that.
Like,
Yeah.
can you move yours right now?
Well, I can.
I don't.
I can like pucker and open pucker. I can pucker.
I
and
don't
release.
think I can.
After 5 children, you don't dare do that. God,
You're just
who
worried about
taught
it.
that you just keep that thing shut? You don't ever go around trying to.
You don't
pucker.
even. Well, you never pee. Do you poop? Because you never pee.
No,
Just
I don't.
checking.
I don't. My hair is brown for a reason, friends.
Oh my gosh.
Oh, we're being mild. Yeah, this is a good subject.
Oh, no, it's
No,
fine.
you know what? Here's the deal. I mean, I wanted Rita to come on because I think this is. I know this is a subject that women want to know
Absolutely.
about. Especially,
Yeah.
I hate the expression. This is just what happens when you get old.
Yeah.
It
I
is
don't
happening, but there's a reason and
Yeah.
there's a way for help. And I
I know.
love that you. My gosh, your clinic is like, yeah, we can take care of that.
I think it's beautiful.
Absolutely.
Well, I can't wait to come on up.
I know.
We
It's-
might be talking
it's
about
one-
a few things up there, honey.
I'll be like,
know, right?
we're gonna start from the eyebrows down. Just, I'm gonna be
We
here
do it all
all
at our
day.
clinic, yeah.
Oh, you do.
We
Tell us
schedule.
real quick what else y'all do.
Oh, well, we do everything. I mean, we do cool sculpting, we do old therapy, so tightening anywhere you want on your face.
I know she's 112. Doesn't she look amazing?
Yes. So we do cool sculpting, old therapy, Botox, any kind of filler you want, facials, massages, lasers, laser hair removal, CO2. Dr. Mears does CO2 almost every day. Plus Genevieve. So yeah, we've got a wide variety.
It's a full medical facility right there. It's up in
Nice.
Bountiful. Give us your address or your website real quick.
Our website is enlightenlaser.com.
EN.
Yes, and then
Yes.
phone number I feel like is worth it. It's 801-294-9999.
Easy.
Very easy to
Easy.
remember.
294-9999.
Rita,
Consultations are free.
I know. come
Genevieve
out.
is 30% off right now. I feel like that's a big deal. It really is.
We need
That is a big deal, but this is on YouTube and it'll be there for a long
Can we
time.
get a buddy pass?
Oh, okay. So
Buy one, get
Papa
one.
Korean, April 2018, right? It's 30% off.
I get people like in 10 years going, but you said it was 30%
I
off.
know, right?
And we're like,
Only
we
through
for
April.
30 days.
April of 2018. Okay, good.
Oh, you're awesome. We love you. Hey, everybody. Shock Talking, remember the name. We talk about shocking things. So don't be all mad if we say things that you go like, oh.
Oh, whatever.
Because-
They're used to us by now.
Because Camille, things come out of her
You
mouth.
don't like it, just click it off. That's all I gotta say. Thank you for watching.
We'll see you next time.
Bye.
Okay, every time this is what we do.
You guys should include this in to be like,